quite a brief situation update today. Minnesota reported 633 cases this morning on a volume of 10,220 laboratory tests processed yesterday. This brings us now to a total of 463,132 laboratory confirmed cases since the start of the pandemic. Another 8 COVID-19 deaths were reported today, for a new total of 6,210 of our fellow Minnesotans who've lost their lives to COVID-19 since the start of the pandemic. There are currently 394 people in Minnesota hospitals being treated for COVID-19. Of those, 84 are intensive care. The 7-day average testing positivity rate is now at 4.4%, which is below that 5% caution level that we have been watching so closely, and it has been below 5% for several days now, which is a very good sign. The vaccination of long-term care residents and workers continues at pace, and we have some encouraging data there as well in the long-term care sector. We averaged 64 new COVID cases per day in all congregate care settings combined this past week. And that's the first week since late September that we've seen numbers that low. We didn't hit 100 cases at all in the past 7 days. So we are very pleased to see that stability in the congregate care sector and looking forward to continuing to make good progress through vaccination of residents and staff so that we can keep that situation very stable. We have more than 565,000 total vaccine doses that have now been administered to Minnesotans at the last report that we have posted on our dashboard. This is a combination of both first and second doses. So the number of people with at least one vaccine dose is nearly 448,000 at this point. So with that, I'm going to hand it to Chris Erzman for some additional background on our vaccination progress.
Thank you, Commissioner. As you may have seen, the governor's office sent out a news release this morning highlighting how the state has ramped up COVID-19 vaccination efforts and is now administering twice the number of shots given per day on average compared to last week. We are very thankful for the hard work by our vaccination partners across the state. As you recall, Governor Walz set a goal 1 week ago yesterday that all providers should get 90% of vaccine received administered within 72 hours and the remainder within 1 week. Over the past week, since that goal was set, doses administered per day in Minnesota have doubled. We still have a long way to go, and we still need far more vaccine from the federal government, but we are getting Minnesotans vaccinated quickly and safely as supply comes to us. The state is continuing to ramp up vaccination efforts this week. Governor Walz has made more than 35,000 COVID-19 vaccine doses available for Minnesota seniors and launched a statewide vaccine finder to better connect Minnesotans aged 65 and older to vaccine opportunities in nearby communities. I want to be very clear, we are still receiving a small supply of vaccine each week from the federal government. While we have more vaccine available for seniors this week than we ever have, it's still a drop in the bucket. Nearly 1 million people are 65 and older in Minnesota. Until we get more vaccine, it's going to continue to be really difficult to get an appointment. As we said yesterday, please be patient with providers. They are working hard, but they have only a limited supply. One thing that I want to mention is that we're particularly encouraged by the continued progress being made on vaccination of long-term care residents and workers. And the data are showing positive signs in terms of reduced COVID cases in those settings. As you heard the commissioner say, we averaged 64 cases a day in all congregate care settings this past week. And that's the first week since September that we've seen numbers this low. We didn't hit 100 cases at all in the past 7 days. We've completed the clinics offering first doses to skilled nursing facilities around the state. And a survey from last week showed that 81% of nursing home residents had opted to receive their first dose. We're starting into the period of time now for second doses, and at last report, around 13% of residents had already received that second dose. Then on a less positive note, I just want to talk a little bit about avoiding vaccine scams. Unfortunately, we have heard reports of people being contacted about COVID-19 vaccine opportunities that are actually scams. We know there is a lot of demand for vaccine right now, so claims that you can get vaccine faster sound great, but it's important to be careful because these could be attempts to gain access to your personal information. So how can you tell if it's a scam? Here are a few ways. If they ask for your credit card, bank account, or social security number, that's a scam. Public health and healthcare providers will not call you and ask you for this information. If they offer to sell you the vaccine, that's a scam. We've heard reports about offers to sell someone the vaccine for a low price. The vaccine is free for everyone through appropriate vaccination clinics. If they say you can pay to get on a list for vaccine or get access to vaccine sooner, that's a scam. Many healthcare providers have lists where people can express interest in getting vaccine, but there is no cost for these. If they offer to ship you the vaccine, that's a scam. You will need to get the vaccine from a medical professional, so any offers to ship vaccine directly to you are not legitimate. There is still a limited supply of vaccine available, so we continue to ask people to be patient. I've said before, our population of individuals 65 and older is 918,000 people, and even with those 35,000 doses for this week, that's only about 4% of that population. So don't be discouraged if you can't get a vaccine appointment yet or are not in one of the groups currently eligible to get vaccine. There will be opportunities for everyone who wants to be vaccinated to get it, but it will take time. Please keep in mind that the individuals who are at the highest risk of disease and death from COVID are individuals 75 and older. So if you can be patient and allow those individuals to get vaccinated, that would be great. But the bottom line is that we just don't have enough vaccine and everyone is going to need to be patient. Thank you, and I'll turn it over to the Commissioner.
I think we're ready to begin questions now, Mike.
All right, operator, we are ready to start the questions.
Thank you. As a reminder, to ask a question, you will need to press *1 on your telephone keypad. To withdraw your question, press the # key. Our first question comes from the line of Jeremy Olson from the Star Tribune. Your line is now open. You may ask a question.
Yeah, hi. I've talked with a few seniors today who they're aligned with certain healthcare providers and they're falling outside of their specific requirements for who can get vaccine. Maybe they're 74 and their provider is cutting off at 75, whereas others are cutting off at 65. And it's creating kind of an uneven playing field. Some seniors are frustrated that their friends get easy access to vaccine through their providers while others don't. And none of this would be happening if everyone was on the same page following the same guidance, but they're not right now. Are you concerned about that variation in access levels provided by different providers, and are you going to do anything about it, or is it just let them get through that and move on to their next groups?
It's a great question, Jeremy. This is Jan, and we certainly acknowledge that it can be confusing and can create the very frustrations that you describe. We have said that we understand with this very limited supply of vaccine that's available that it makes sense for providers to try to do what they can to make sure that the most vulnerable people get vaccinated first, and they know their patient population certainly as well as anybody. And yes, they have taken some different approaches, which I think it depends upon kind of their local circumstance, the amount of vaccine that they have, just demographics in their community. So we recognize that there is some variability there. And again, I think Chris made a good point. If people can just give that patience and work through the processes with their providers that they've set up, that is a good way to go. They certainly are free to continue to look for other opportunities to get vaccinated through others who may have vaccine in their community, be that pharmacies or for the state sites that will be operating still in a couple of locations around our state. So we appreciate that there's some variability. We're trying to give people more choices, and this whole situation should continue to improve as more supply comes into the state.
And Jeremy, this is Chris. I'll just add, you used the phrase, their friends are getting it, they're easily getting vaccine. And I think it's important to note that while there have been some individuals who have been fortunate to get vaccine, I don't think anyone is getting it easily because we just simply do not have enough vaccine.
A follow-up question is, I mean, we now have a population of more than 100,000 people who have completed both doses. A lot are healthcare workers, a lot are long-term care, but soon it's just going to be seniors in the community. It's been a long time since we used the term immunity passport, but what are we going to do with these people? Are they going to be freed from restrictions, able to go around, do around whatever they want? Or are they going to have to abide by the same restrictions even if they have a level of protection that most Minnesotans don't?
Great question again, Jeremy. I think, as we've said, there are a couple of layers to this. I mean, first is the protection against severe illness, which is what we know these vaccines do. What is unknown yet is whether what impact vaccination has on one's ability to transmit the virus to others. So until those data are more clear, as they will be as more experience is gained, we still are going to be encouraging people to follow all the other guidance with respect to social distancing, masking, and the like. So, Chris, would you add anything?
No, I would just say that, until we've reached the point where we have, 80% of our population vaccinated, everyone needs to continue the community mitigation measures that we have in place for the reasons that the commissioner said.
Thank you.
Thank you. Next question comes from the line of Courtney Godfrey from Fox 9. Your line is now open. You may ask your question.
Yeah, thanks for taking my question. Can you discuss the word effective as related to vaccines? The general public seems to be focusing on this effectiveness, comparing the, say, 95% effective vaccine to the 75% effective vaccine and maybe seeing it as lesser than. Can you discuss why maybe those that effective rate is not necessarily the way to look at it, as we're seeing that deaths have been eliminated and drastically reduced hospitalizations?
Chris, would you take that?
Sure. Yes, I mean, it's absolutely reasonable to talk about vaccine effectiveness because we certainly have talked about that over the years. The measles vaccine is 95 to 98% effective. The influenza vaccine has an effectiveness that's more in the, 50 to 60% range. So people are used to thinking about vaccine effectiveness, and we've been very fortunate that the first two vaccines that were approved have effectiveness of 95%, which is excellent. The new vaccine that I think people are thinking about or talking about is the Johnson & Johnson vaccine that has not yet been approved, but there have been data that have been put out that talk about the level of effectiveness expected from this vaccine. And you're right, it's less than what we've seen with Pfizer and Moderna. So I think there's a couple of things to keep in mind. One is that the Johnson & Johnson vaccine requires only a single dose. So that will be a vaccine that will be really useful for populations in which we think, the chance of these people coming back to get their second dose are not great. So that is something to keep in mind. That vaccine has the benefit of just having a single dose. And as we get more vaccines that are on the market, our encouragement will be for people to take the vaccine that they're offered. They will all be effective, and they will all have made it through the FDA approval process, and they will all be recommended by the ACIP. We can't look to having perfect individual protection, so we have to focus on the fact that we're going for broad community protection. So our goal is that to have as many people as possible who have protection, and so that'll be more important to us as Minnesotans than selecting a particular vaccine over the other. So our goal is to make sure we have that broad community protection with more than 80% of our residents vaccinated, and that's what will really get us to the end of this pandemic, more so than whether or not the vaccine I got protects me at 80% and the vaccine that you got protects you at 95%.
And Chris, maybe you could just reinforce the point that I think the questioner asked about even the Johnson & Johnson vaccine with lower overall effectiveness is still highly effective at preventing severe illness and hospitalizations and death.
No, absolutely, yes. I mean, I think we're in a place where we are so fortunate to have such good vaccines available so quickly that the fact that we're sort of quibbling over a few points of effectiveness is actually kind of amazing and positive.
Thank you.
Thank you. Next question comes on the line of Anson Murphy from WCCO-TV. Your line is now open. You may ask your question.
Yes, thank you so much for taking this question. This question comes from Jeff in Andover, who is frustrated trying to get through for his in-laws. And he tried to go back to the registration site that was opened last week, and it says new pre-registrations are not being handled. So for Jeff from Andover, what should he know about that wait list? Does it still exist?
Well, this is Jan. I'll start, and Chris, you can chime in. That wait list that was built over the last couple of weeks is not currently open. It may very well be opened again in the future, but it is still being used in a couple of different ways. As was just announced yesterday, instead of the 9 smaller pilot sites, there'll now be initially 2 and eventually perhaps more larger, semi-permanent, you might view them as, sites, the first 2 in Duluth and Minneapolis, a third planned for the southern part of the state. And though that wait list will continue to be used to randomly draw people for appointments at those sites. But in addition, we are trying to find ways to make use of that list of folks who've expressed interest in vaccine to be able to communicate with them, in a kind of bi-directional way to let them know where there are other vaccine opportunities. So if Jeff's relative is not yet on the list, we certainly encourage them to check out that vaccine finder website and see where there is vaccine, geographically near them. And again, there may in the future be additional opportunities to get into that waitlist process, to have potentially have access to more community sites when those open up. So it's not the answer of is it closed today? Yes. Is it always going to be closed? No. And that we'll be building other ways for Minnesotans to just kind of register their interest in getting connected with vaccine as the supply builds.
And when will the Minneapolis, Duluth, and southern Minnesota sites, public sites, be open?
I believe, and I'm sorry I don't have the days and hours just right in the front of my head here. Chris, maybe you do, but I think the Minneapolis site is opening, is it Thursday for a couple of days? And I think the Duluth site opens on Sunday, if I'm not mistaken. But those details will be posted on the web.
Right. I don't know the exact. I was going to say I don't know the exact dates, days of the week either. But we do know that they tend to be at the end of the week because we want to make sure that the vaccine has arrived. So it's the shipment has arrived, so it tends to be the end of the week.
Right. And you folks have been so clear. I hear your frustration saying we really just don't have the vaccine that's out there. It might help people knowing at this rate, when will you have all the 65 plus seniors vaccinated? Will it be, it's going to be weeks, obviously.
Yes, it will be. I mean, as made, so there's been some positive things. I mean, the last 2 weeks we got a 16% increase, and now it sounds like we'll be getting a 5% increase on top of that, which will bring us to, roughly 21% increase in our doses. That makes a difference. And if there are additional providers who have their vaccines approved, that will add to the supply of doses that we have available. But you're right that with the rate that we currently have, we're looking at, several months. So, 16 weeks to get through the populations that we need to get through. And I think if people can keep that in mind, that may help to ease their frustration. If they think, you know what, I'm not going to worry about this for another week or so, I'll let those very senior elders get in first, and I'm going to, just kind of kick back and wait. That might not be a bad idea, because we do know that it's going to take a number of weeks to have sufficient vaccine supply.
16 weeks for all seniors.
Yeah, at least that's based on our current vaccine availability.
Thank you so much.
Thank you. Next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is now open. You may ask a question.
Hi. Yeah. So first question is this: when do you expect to see the effects of the immunizations that have happened already on case counts or deaths or any sort of other metrics? Do you think that has played at all into any of these positive trends we've been seeing, or is that related to something else?
Chris, could you take that?
Sure. Yeah, I mean, the data that we mentioned about the reduced number of cases in our long-term care settings, we're optimistic that should continue to drop. It's early days, and so I don't want to, as you've heard us say a million times, one day or 1 week doesn't mean a trend. And so I guess even when things seem positive, we can't take credit too early. We'll have to wait for a few more days and weeks. But right now, the trend is exceptionally positive, and we're seeing our case numbers in skilled nursing facilities way down, and that's excellent. And those are the facilities that have all had the opportunity to have first doses administered. Now, obviously, not every single person has chosen to be vaccinated, but nonetheless, the impact of vaccination seems to be having a positive effect. And I think in the weeks ahead, we'll be able to say that with greater confidence. As I said, even when things are good, we still have to say a day or a week doesn't a trend make.
Okay. And a follow-up question. We've been getting a lot of emails and phone calls from people who are on chemo, or who, are at home getting assisted living services. For instance, it might be on a ventilator at home, who are like under 65 and cannot get a vaccine right now. And I guess I'm just wondering, like, what you might say to this group of people who, are clearly pretty vulnerable with their health, but don't quite meet the cutoff for getting the vaccine at the moment.
Well, it's just a great example of some of the challenges and the frustrations and the concerns around the pace of vaccine coming into the state, as we've been talking about. That we know there are many groups and folks who have some health conditions. They're medically fragile. They're at home. I mean, and certainly, again, reinforcing the value and the importance of moving beyond the population of people who are in long-term care settings and moving into the community to find and serve people who are elderly and at home. And we absolutely need to get to the medically fragile population as well. Chris, I don't know if you would add anything there, but it is a particularly good example of the problems with just the limited supply.
Yeah, no, I understand what you're saying, and I've received those emails myself, and it's heartbreaking that we don't have enough vaccine. right now, and that we don't have vaccine for everyone. We have tried to stay on target with our Immunize for Impact, and so as we've been making vaccine available, we're providing it and we're recommending it for those who are at the highest risk of disease and death, and that has been our elders in skilled nursing, long-term care, assisted living, those settings, and other people that are in congregate living settings. Then we've looked to elders because we know that, over 70% of our deaths are in people 75 and older. When you add the 65 to 74, it adds about 16%. So not as dramatic as that older group. We know that these are vulnerable populations, and they need to get vaccine as soon as we have more vaccine available. But unfortunately, that is the problem. We absolutely just do not have enough vaccine available, and we are trying to manage multiple really important goals and priorities, trying to balance all of those things, and it's really difficult.
And just to be clear, when the federal guidance came out saying that the states could vaccinate people 65 and older and those who are at high risk, is the state not following that second part of the guidance? And so, what would need to happen to get there? Or do we need to move out of the long-term care setting, get that done and then shift those vaccines to that group? Or do we just need more right away to get to them, if that makes sense?
Yeah, I think that's a great point. And as Krista said, the situation's pretty dynamic and is changing, literally week to week. And as we get a little bit more supply, we can start to work with our providers to expand, those at-risk populations further. And I do think, as we continue to work through these first populations, the congregate care settings and the healthcare workers, that is going to free up the ability to try to get doses to additional groups that we recognize are at higher risk.
I will just add too that every dose that is given to someone reduces the chance for spread in the state. And so even if an individual is not able to be vaccinated, the more people that we get vaccinated in the state, the bigger difference it makes on our transmission rates, our overall numbers, and that benefits all of us. So just even as we're struggling with how we can get vaccine to each of these different populations and the individuals within them, I think we want to keep in mind that the overall positive messages, each dose that's administered in Minnesota is benefiting everyone.
Thank you.
Operator, we have time for one more question.
Sure. We have the line of John Crummins from CARE. Your line is now open. You may ask a question.
Hello. Thank you for taking the call. Circling back to the fraud question, is this something that MDH has people to investigate in terms of trying to trace who's making these fraud attempts, or is this something the DPS or local police would be involved in?
Chris, can you take that?
Sure. Whenever we hear about these unusual situations, we do try to follow up and alert people. So, we've had situations where there will be, say, a phone number or someone appears to be calling from the health department where it's not accurate. We will take the necessary steps to do follow-up. And if that requires involving, law enforcement, that will happen. And so, yes, we definitely, if we're made aware of things, we definitely make sure that there is follow-up that happens. It usually involves providing information to others outside of the agency because obviously our role is ensuring the public's health, but we can alert people when we're made aware of inappropriate use. And I think it's really important that people know that, we do not want credit card, bank account, Social Security, any of those things. In fact, I was talking to my dad the other day on the phone, and he was telling me about signing up to try and get on the list for vaccination in Florida where he is, and he was listing the things that he had to get ready, and he said Social Security, and I said, no, Dad, no, they will never ask you for that, and if they do, you can't give it. So I think that's the key, is that yes, you want to be on a list with your provider, you want to make sure that you've made it known that you're interested in being vaccinated, but that should never involve giving any of that private information out.
Thank you very much.
All right, that is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we'll be back with you again soon.